if you're in Canada, how long did it take you to get a family doctor? How long? Just put it down in the comment section. Sometimes I go to the emergency because I feel so sick and I just tell me, oh, your body's just fighting the virus. You're going to be fine. I'm like, when people in Nigeria, if I have one symptom, I already know what is doing me. It was drug abuse. Yes, I know. But we do it so confidently in Nigeria. Like we know the drug we are buying. Hello everyone, welcome back to my YouTube channel. My name is Funke Lemo. I am a Nigerian immigrant in Canada and I post videos about my life in Canada. So in today's video, before I go there, please, I want to say a very big thank you to everyone who has watched my video, who has shared, who has dropped a comment, and who has always made me feel like I'm doing a very good job out there. I really, really appreciate your comments so far, your views. So please, I'm begging you, do not forget to hit the subscribe button. Thank you guys so far for the love and the support. And let's get right into today's video. In today's video, I'm going to be talking about the healthcare system in Canada. I mentioned in my last video with my friend Lara, and I know that if you had seen that video, you get what I mean. But if you haven't, please make sure you click on the link and go and watch that video so that you understand where I'm coming from. We've mentioned that free healthcare is one of the major advantages as a permanent resident in Canada. But there is it's free, and the truth is it is free for permanent residents or citizens because you get that's what your tax is paying for, which is really really amazing. You get basically like me having my daughter was absolutely free. I didn't have to pay anything, and it was amazing. But there are some things that you know it's always very hard, like getting a family doctor. And that's what I want to talk about today because that's something most people don't get to talk about, but it's very, very challenging when you relocate into Canada and you're trying to get a family doctor. I don't know how it is in other province. I really do not know. But for Ontario or for where I am at right now, it's it can be very, very tedious. When I came into Canada pregnant, I didn't have a doctor. I just came, I'm pregnant, I didn't have a doctor. And the first time at the hospital, for a checkup, because I went because I remember I was having back pains, and I think it was because of the long hours of flight. So I went to the hospital. I went to the emergency straight because I didn't have a family doctor or anybody to call and anything. And yeah, they saw me immediately because once you're past 20 weeks or 24 weeks, you'll be directed straight to the maternity ward. And they saw me immediately and I was checked. And the first question I was asked, do you have a doctor? And I said, no, I just came into the country. And they said I have to look for a doctor. So that for proper follow up and check. And that's when I knew how tedious it is to get a doctor. So as much as we say healthcare is free, some things are really, really hard to get. If you need a doctor, you have to have applied to several, clinics, be on the wait list for a really long period of time. I'm just going to say, like, for an average, before people get a doctor when you relocate, it's always like an average of 6 months before you get a family doctor. Only if at the time you come, there is a doctor presently taking patients. So this is how it works. When you come into Canada as an immigrant, if you come as a permanent resident, you want to immediately start looking for a doctor. Yes, you have to look for a doctor that would take you up as a patient. If you're pregnant, it's very, very tricky because you need to get a doctor as soon as possible for your antenatals, for your shots, for checkups, regular checkups and everything. So you need to get a doctor as soon as possible. If you're pregnant, once you have an idea of where you want to have your baby, you quickly start looking for a doctor. You look for the gynecologist in that area that might be accepting and start calling. That's what I did. I kept calling and calling until I saw one that picked up my call and said, okay, yes, we could take you up as our patient. That's how it is. It's free, but this is I don't want to say this is the part that you have to pay for. Like you calling, you finding a doctor, you looking up, searching, that's what you have to pay for. And it could be a disadvantage. This is what I mean by that. The healthcare system is compared to where I was coming from, seriously, it's by far okay. But there are some disadvantages. Meaning, if you're someone that you have like an ailment, or you have like a health condition that you have to consistently be seeing a doctor, and you don't have a family doctor on arriving, it might be very, very hard for you, because there and then you have to be going to the emergency every single time. And guess what? Emergency in Canada, I don't want to say it's not emergency, because the wait hours are always so long, and it's actually called emergency. If it's a dying or life and death situation, if it's a very, very, like, I'm not saying they will not attend to you, but maybe something happened and you call 911. Of course, the first responders will come to you and offer you all the help, take you to the nearest hospital, and get you treated as soon as possible. But if you having stomach pain, or you broke your hand, or and you don't have a family doctor that you could just call and book an appointment, you have to go through the emergency. And when you go through the emergency, you can be in the emergency for 8 hours. In fact, when you get there to log in, they'll tell you that there is a 8 hour wait, because of course they will be responding to those that have people that have urgent need first. So you have to wait there. And I realized that the wait hours, I just think that the wait hours are always that crazy, because most people that you see in the emergency, they actually don't have family doctors. And coming to the emergency is the best way for you to get someone to see you. And there are also options like walk-in clinics. Walk-in clinics, you might have to call to book an appointment, or you might have to go in there and wait. That's the thing. What you pay for is the waiting. It's free, but what you pay for is the waiting. I have a feeling that, if we were paying for the healthcare, like cash in, cash out, you'll be able to demand some things like hands on, like, and say, okay, I need to see my doctor now. I pay, you understand? And you can say I directly pay for it, so I need to see my doctor now. I'm able to demand for some things. But here in Canada, you have to wait. You'll be on a long wait list. Before I got a family doctor, it took me almost 1 year. What am I saying? Almost 18 months before I got a call back from the registration I did like several months ago. So if you're coming as a family into Canada and you feel that you have a medical condition that requires you to always see a doctor, immediately you land, you want to start asking for doctors that are taking up patients. And this is how you can ask. You can research, check on Google, check for doctors taking patients near me, call, check your communities, like WhatsApp groups of your groups. Like, I have a group where we're just Nigerians, and they put some information there once in a while of doctors taking patients. You might want to check walk-in clinics to see if there's anyone that can take you up, and like that. The same challenge that I faced when trying to get a doctor for my daughter, because you have to get a pediatrician where you put to bed, for vaccines, for all those things. You have to make sure you have one. Before you give birth, your doctor will be telling you that, have you found a doctor for your child? Have you found a doctor for your this? So you have to start making all those researches, calling doctors to see if they can take up your child. There are provisions for several kind of doctors. If it's a special need child, if it's a preterm child, there are provisions for that. It might just take you work to get one. And in case you don't even get a doctor for your child or for anybody, there are places that you can always go to get vaccines. So there are like substitutes, like there are places you can walk in and say, okay, I'd like to get a vaccine shot for my child. She's 3 months old or she's 6 months old. I don't have a family doctor or a pediatrician, but I need her to take a shot. There are places you can go to for that. So in case if you don't have a family doctor, I'm saying this based off on what I know so far since I came, and people that I've met that are immigrants also, they don't have family doctors. They go to places, they use walk-in clinics, they use emergencies, like if something is going on, they use emergency services, and because that way you get fully checked when it's your turn, although it's a long wait, but you get checked. But if you're pregnant and you're coming in, know that if you're above 28 weeks pregnant, it's 28, 24 weeks pregnant, you don't need to go through the emergency. You can go to any hospital, to the childbirth center directly. because they're going to prioritize your pregnancy because it's way above second trimester. That's what they do. I have seen people that are in Canada but will still go to their home country to get some particular healthcare services because of how fast it will be for them, and because they get to pay for it and it's faster. There are several TikToks I see or reels on Instagram about healthcare in Canada that says, oh, if you go into the emergency after 8 hours and the doctor checks you and the doctor just say, oh, you're good, just use Advil. Oh, you're good, just use Tylenol. I think it's like that because this whole healthcare system is very, very sensitive, and because you can hold them accountable to anything that happens, they're always very careful before they administer anything to you. Always very, very careful because you can hold them accountable for it. I've had to go to the emergency before, um, and I know back in Nigeria, when you go to the hospital, you just want somebody to see you quickly. Of course, you want someone to see you quickly. You want someone to just tell you, oh, this is what is happening. Okay, you need to buy this drug. You need to buy this. You need to buy this, that. I don't think they are like that here. That's the truth. I don't think they're like that here. Like, I've had situations whereby you go to the hospital and you feel like this is a very, very serious case. And when the doctor sees you, they'll be like, oh no, you're gonna be fine. She's gonna be fine. She just needs to, our body needs to just fight the virus. I'm like, I've been here for over 10 hours to see you people, and you're telling me that my body needs to fight the virus. My body needs to fight the virus. Like, write me a drug, write me something to go and take. But that's the way it is here. They are so very careful. They are so, like, they are too careful. Like, I don't know what to call it. Like, I don't know what to call it. They are too careful. But I'm telling you for real, they'll just tell you, the body will fight the virus. If you have a little bit of fever, just take Tylenol. If you have a little bit of, so far you don't have any underlying condition, you are good. After the long wait hours, they can just tell you that you're free to go. Your body's going to fight the virus. You're going to be fine. If you feel so way, just take Tylenol or an Advil. Tylenol is like paracetamol, like a pain relief drug, like for fever and stuff. That's it. If it's a viral infection, they'll tell you, oh, your body will go through it, depending on the kind of viral infection, of course. Like Nigeria, where you can go and buy amoxil in the hospital. In fact, you can prescribe your drug yourself. In Nigeria, if I have one symptom, I already know what is doing me. I'll just tell myself, go to the hospital, get this drug. No, go to the pharmacy and get this drug. I know the mixture. And when I take it like this, I am fine. But here, it's not like that. They will tell you your body should fight it. And another thing they have, apart from walking clinics, is also virtual appointment. So um some clinics have the ability, like, if you cannot go in to see the doctor, and because when COVID happened, a lot of things changed, a lot of systems improved, things became virtual in a way that humans never thought about it before. So there's called, I think I've used virtual appointment once. I was feeling so sick, so sick. If I was in Nigeria at that time, I know what to go to the clinic to go and buy. I know what to buy at the pharmacy. It was drug abuse. Yes, I know. But we do it so confidently in Nigeria. Like, we know the drug we are buying and we know why we are, and we know that we'll be fine after taking it. I did that a lot of times. Do I do blood tests in Nigeria? Kilo Njebe. Blood test for what? I know what is doing me from symptoms. I know what is doing me. But here it's not like that. And that's how it is expensive. Because where we are coming from, we don't do things that way. So it's different here. And it looks like, oh, these people are taking time, these people are dragging things. That's how somebody will just die. You people will not know. But no, it doesn't happen like that. They are no they are no they don't take human lives, even animals, they don't take it with joke. Talk more of humans. So they are very, very protective about human lives. If they recognize that a situation is critical, of course they're going to attend to you very well, especially if you go to the emergency. So back to what I was saying, I was once sick, so sick, and I did a virtual appointment with a doctor, and the doctor just told me that I should do a COVID test to be sure that I don't have COVID. Even if I had COVID, I would just have to stay at home. get hydrated. There is no drug for it. There is no treatment. Your body will have to fight it. That's what they will tell you. Your body will fight it. But if you feel this way, you can get an over-the-counter pain relief drug that you could use to make you feel better. They don't just write drugs anyhow for you. They don't just recommend drugs anyhow for you. Like the one that amazes me the most was, after giving birth, and they tell you that the child is not taking any vaccine until the child is 2 months old. That threw me off because I have friends that have had children in Nigeria, and I know that after you give birth to your child, within the first 7 days, the child is already taking injection. Like the baby is already taking injection. Like, why is it different here? Why? Why do you have to wait 2 months? And they said no, there is literally nothing that should happen to a newborn at that period because child is a newborn. Only if there are underlying conditions that was recognized at birth, then of course there'll be proper follow up. They do proper follow up. That's what I know. The system might be draggy. Before you get a doctor might take forever. But when you get to see one, they do proper follow up. You have every right to call the doctor, ask them questions. And that's the richness of the healthcare system compared to where I'm coming from. It has its own bad side, of course, that I've mentioned, the long wait and everything. But they do proper follow up. They do proper checks. In fact, they can ask you to do tests over and over again just to be sure of what they're seeing, but they do proper follow up. Yeah, so that guys, that's it. My experience has been like that. Sometimes I go to the emergency because I feel so sick and I just tell me, oh, your body is just fighting the virus. You're going to be fine. I'm like, I feel me low going, people eat. But they will not give you a drug. And funny enough, your body will fight it and you feel better. We are so used to getting pumped by drugs. We are so used to getting, take, oh yeah, mix a leg ball, but they don't do all of that here. They don't do all of that here. So know that it's different. Getting healthcare system is free for permanent residents, but getting a doctor is expensive. It will take you forever. So guys, that's it. This is just a conversation majorly, and to just give you throw out the tips out there. Like if you want to if you want to come to Canada, or if you're coming to Canada, you know what you should start doing. Like you should know what you should start doing and preparing yourself for, like on landing, in order to help you get a family doctor. You have children, you want to look for a pediatrician that will take up your kids, or get a family doctor. So there are several ways to do it. Like you could get a family doctor that covers your children and yourself. That's why it's called a family doctor. Or you could get a pediatrician for just your child up until the age of 18. The pediatrician will monitor your child up until the age of 18, or your children. Because once you have a pediatrician for one, it's most likely that the pediatrician will want to cover all your children. Do you understand? Or even when any new one comes up, they'll cover all of that. Before I got a family doctor, I had a gynecologist because I had to have a baby. The gynecologist will now be in charge of anything that has to do with my, my fertility world or my fertility life. If I get pregnant again, the gynecologist should still be the same person to care for me and to book appointments and stuff like that for me through, do you understand? Throughout my life, because I already got one and my file is already with them. So it can be challenging to get one, but once you do, you know that okay, you're covered. You're covered, and change your mindset. It's hard to do, but change your mindset. And what I mean by that is like in Nigeria, you know how you just go to the pharmacy and you just get a drug and you say, I feel this way. But that with malaria alone, shame I need to take so drug, I need to take it might not. Since I came to Canada, I've not used malaria drug. Have I felt those symptoms that I used to feel in Nigeria? That I'll say, oh no, this is what is wrong with me, and I just go to the pharmacy and buy anti-malaria and buy this and use it. Yes, I felt those symptoms, but I've not used malaria drug. Was I misusing drug then? Maybe. I'm telling you, on the WhatsApp group that I am till now, I still see people that still say, okay, please who have amoxil in their house, or who has is this anti-malaria drug that they brought people bring from Nigeria to use here. You understand? So I didn't do that because I feel like if I'm sick, I should be able to get, someone to tell me this is what's wrong with me and do a test and or be able to rest and feel better. What we do in Nigeria is slightly different from what they do here. Just know that. It's totally different. You cannot just go into the store and pack drugs and use. And if you have drugs in your house that you use, please be very careful. Because if anything happens and you now go to the hospital here, they will ask you questions. Did you take any drug? What did the drug contain? So be very, very careful. I know people still do Nigeria drugs here in Canada. I'm not saying you shouldn't, but be very careful. Be sure that you are diagnosed of whatever it is you're taking drug for. Because when you come here, things change. People don't like to accept that, but that's the truth. Things change. So if you're still using your drugs from Nigeria, your this from that, be very careful. That's just what I would say. So I guess we are learning. I guess things are changing because I know myself before. Any small thing I for don't swallow, but now I don't want to tell me that I need to just rest. I need to just because people are here, they are healthy. It's not like they are healthy people. So why do I think that the drug I'm bringing from Nigeria is way better than what I'll get here? I don't know if you get me. But it might take a while for your body to just adjust, for your mind to even adjust the way things are. But yeah, that's it. I told you now. I've been to the emergency and I was feeling like, oh, people need to give me drip. People need to give me injection. People need to give me drugs. And the doctor was just going to say, you're fine. Your vitals, your substance is a bit high. And I think it's because of this. Just try and rest. Try and use a pain relief. And that's it. And they'll tell you you'll be fine. Your body's gonna fight it. You'll be fine. You don't need to take drugs. No, no, no. You don't need an antibiotic. You'll be fine. But in Nigeria, sharp sharp, we'll have broken drugs. So be very careful. I know people that come with children too. They come with drugs and all of that. They'll tell you here that it's normal for them to get all those infections. Their body's going to fight it and it gets better. Like their body build the immune system gets stronger. But I know what it is like for a mom to see their child sick and feeling like, oh, if I was in Nigeria, Lily, what okay, alright, ballet. Just take the child to the hospital here and trust the doctor enough. Trust the doctor enough for whatever information they give you. If you don't feel confident about it, you can seek a second opinion and hear what they're going to tell you. Or do blood works. Let the blood work show you what's going on with the child. Then you know that everything is good. If you need a family doctor, the earlier the better. You start searching on landing for doctors that would accept you, then yeah, that's how it works. So thank you guys so much for watching, and I will see you guys in my next video. Don't forget to like, subscribe, and understand what I'm trying to say, basically. Healthcare in Canada is free, and getting a doctor can be expensive.